And I am extremely pleased to be able to talk about this because this filter is obviously near and dear to my heart. I've been with it since the beginning. And by that, I mean since the beginning of this filter, and before that we had a lot of discussions as well. But filters themselves, as everybody knows, are decades old. The Greenfield filter being introduced around the time I was in elementary school. And then after that, in 1990, that's true, I was. That's how you, it was. I was just, yeah, so I was there. And then in 1990, the first filter that came out was nitinol. So now we're building on. You see the difference in these filters as we go through. And the next filter was a single hypotube, which is better because it decreased the weld points and is not as likely to break. That was in 2001, I think. And then that was right before the new entry of the retrievable filters, the first one being the Tulip. And then in 2010, we presented our trial of the original option filter itself. So you can see how these filters do not look the same. They are not the same. It truly has been an evolution in everybody trying to make their filters better as we get more data and we understand more what's going on inside the body. And that's true in the option filter itself. This presentation is about the evolution of the option filters to the OptionELITE. Neither of these is that. So I'm going to point on this screen, but this is the original one that we started working on in our sheep. And then because of what I'm about to show you, we changed it. And the reason we changed it is because if you can see this, and I apologize for people looking at that screen, but I'm going to point at both. You can see this strut that went straight out all the way. It was clearly outside the vena cava, clearly penetrating, and it wasn't the only one in this sheep as we were evaluating this. And you can see this was back in 2005. And so we made modifications, and the modifications that we made were to change the feet. And so I'm going to show you the feet now and the things that were done that turned out to be extremely beneficial. There are three different, There are three different things that matter. One is that we extended this. So we've already had that. That's number one, is to have this hook pointing up. But you can see the serrations on the bottom of this, the grippers that you can see, and then an extension to keep it from penetrating. Like I call it a foot pad. They call it I've always called it a foot pad, but I learned today, or a little bit recently, that we should be calling it an extension. Both these filters are single-piece nitinol, so using that methodology, electropolishing, which decreases fracture rate, and we know that, and I don't know why, but the engineers know why. If you smooth it out, the filters are less likely to fracture, and these have been electropolished forever. I also learned something. You might ask, why do you give a talk like this? Why, when you've been doing it for so long? One thing is that I learned stuff from it. And I remember doing the trial and knowing we had discussions with the FDA about and using the 510K process to get the filter approved, and I knew that we couldn't say what I wanted to say because these are clearly filters that we were putting in cavas that were bigger than the standard 28 millimeters. And I had thought until today that what we ended up in that discussion was that the option can be used in cavas up to 28 within FDA guidelines. As it turns out, it is cleared for use in 30 millimeter cavas. So I learned something just from the lecture that I prepared, and that is that, and when you have to go back and check the data that in detail, you realize that sometimes your thoughts are not what you thought they were. And this is actually, now you can use this filter in vena cavas up to 30, and that's approved by the FDA. The flared strut pattern was there, and we've seen that. It's better to have conical filters that direct things this way instead of flow, like if you put a filter in like this, the blood flow goes this way. It interferes with laminar flow, and you cause increased rates of thrombus formation because of the change in the flow characteristics through the filters. So these are good filters that direct flow that way and direct clot that way. So that's another thing that you should think about when you ever look at these computer-generated flow models and the actual flow models themselves. And then this is the deployment system. They used to say that it was 6 French, but it's actually 6.5 French out on the outside, but it's still extremely small and extremely to put through using very standard equipment. The curved pusher, this is I've argued with Jim McGuckin since the day that we started talking about this, that he loves the curved pusher. It's like the best thing in the world, and you can feel it. I put it through the neck. I almost always put my filters through the neck. He puts his filters through the groin. I think there may be a benefit if you're doing groin filter placement. I don't know. I don't do that very often. But it doesn't interfere with my placement from the neck. I mean, you get nice centering on this. We showed that in our study. We got follow-up study that shows that it centers quite well. And as I just mentioned, you can put it in from above or below. It's very clearly marked, but do pay attention to which side you put it in because it goes in easily. Just got to make sure you put femoral through femoral and jugular through jugular, and snap it in. This is also gratifying to me to have this in this detail, in that the things that we saw in our study of the first 100 patients of this is that all these things you see are very close to the same in the follow-up in the next series. I love to see data being repeated to suggest that what we thought is true is true. And also I liked, the only thing that's substantially different is the occlusion rate, and it's much less in that filter or study. And we were being extraordinarily rigorous and reporting things like caval occlusion in people who already had cavas that were filled with clot when I put the filter in. I did one of those caval occlusions as mine, and I put the filter on top of clot. That counted as a caval occlusion, but we needed to do it. That was fair. So I'm pleased to see, as we move on, that the things that I thought were true appear to be true. But that then brings in what's different now. And one of the knocks against the option filter is that it's harder than other filters to take out, than some other filters. Not all. I can go through them in great detail if you'd like. But in my answer to that was you put the filter in, you want it to stay in. You don't want it to move. And it seems to me this is pretty much hitting the sweet spot. But we did studies of this. So here's what's happened. The OptionELITE, I'm going to show you what happened. You can see that the hook looks a little bit different, and that's the important point. But also the feet have been changed, and I think that's important. This is a little cartoon. It's not the world's best cartoon, but you can clearly see that those 3 big hooks have been replaced with little hooks, and that matters. And it matters actually in practice, and it matters in the lab. This, we've already talked about the anchors and the hooks and the grips and that stuff, so I'm not going to go through that again. Same idea. I hope you guys can see this, because these are the data that, and I did a lot of this. So what we did in the top half of this is we took a whole bunch of different filters and we pulled them out of sheep at 1 and 3 months. And you can see that the forces that were used in the option were in the 7s range, 7 foot-pounds in this kind of area, which is a tough thing. You get up to 12 and so it's really hard. So pulling out that, and if people have used this filter, they know it's been kind of tough. Not impossible, it's not that difficult, but it's harder than others. And so what was done then is they modified the feet, and we tried it in, and I didn't do the OptionELITE pulling out of sheep part. I did all the stuff at the top, but I didn't do the bottom part. Some Yahoo did, but it was a talent. Was it you? No, okay. But he was pretty good at it, and the data are straight across. And what you saw in that model, and then subsequently in the in vitro model looking at retention force, which is here, this is an in vitro model of retention force, is that it decreased the need to withdraw. The withdrawal force is much less with the option, but the retention force, meaning does it stay in the cava, stayed about the same. So that was, in my belief, in the animal lab, that was a great modification. And it turned out in the clinical lab that it's worked as well, and I'll show you that. Why does that matter? Well, you can take out filters, and because I do so much with filters, I take out filters that have been in for a long time. The harder the pressure, the more complicated. It's just really hard. And you can look at this one. This is a filter that I've pretty much had to do everything in the world to take out. I'd already straightened the hook up, so I eventually needed to use graspers to pull onto this because I made the hook straight. And I lost it in the cava, so I had to grasp it from below. It had a penetrated little tiny foot here. This is not an option. But it had been in for years. It had been in for years and had penetrated everything, and we needed to take it out. It was causing pain. But eventually, this is a laser. So I had used a laser. I'd used graspers. I'd used this. It'd be nice if you didn't have to do that. I mean, if it stayed, did its job, didn't penetrate, could take it out when you wanted to. So I at this time didn't know whether this was an option or an OptionELITE. But it was a filter I thought was appropriately taken out. We'd put it in a year ago, prior to a guy getting a liver transplant and he had clot at the time. He needed it. So then he came back. He's asymptomatic, has had his transplant, no longer needs it because he's anticoagulated. So we look through when do you take out a filter. I'm not going to go in for length about all this. I've given this talk with this case before. The cavagram took place at 252. The snare was out and snared in 8 minutes. And that's a year-old option. So it's not like it's impossible, but to make it even easier without that need is pretty impressive. And so we were one of the centers that evaluated the first ELITE, and I didn't put in a lot of them, and I didn't take out a lot of them, but it was obviously easier to take them out. And now that it's out and available in practice, it is clearly easier. And I'm going to give it to Dave Trost from Canal, and he'll talk about his study, and then we'll move on to talking about the over-the-wire technique.